Hi, I'm Dr. Dennis Woggon. We're going to take a look at the arthrostim cervical adjusting. We're going to take a look at the lateral cervical x-ray first. We can see that we have a lordotic S-curve, so there's a lordosis up on top and kyphosis on the bottom. So this has got to be corrected. When you look at the occiput is actually sitting inferior on the posterior aspect, and so is the atlas. The occiput is inferior 27 degrees, 18 degrees is normal. The atlas is inferior 22 degrees, 18 degrees is normal. So what we've got to do is bring the occiput inferior to superior and bring the atlas inferior to superior as well. When you look at C2, C2 is sitting with a vertebral body baseline at a plus or a high 7 degrees on the posterior aspect. It should be actually sitting at a minus 10 degrees. So the adjustment that we're going to be doing here is actually bringing the occiput from inferior to superior with the double prong, bringing the atlas from inferior to superior, and then we're going to take the single prong and we're bringing the C2 spinous from superior to inferior. As we look at the lower spine here, what we're seeing is all these lines, vertebral body baseline, should be converging. So C5, C6, C7 aren't doing that. So these have all gone posterior. So we're also going to come in with the arthrostim adjustment and adjust these from a superior to inferior line of drive. What we want to do is use that spinous process as a lever arm to help improve that cervical lordosis.
En esta radiografía lateral del cuello,
We're going to look at the cervical flexion x-ray. Now normal would be 60 degrees, she's at 14 degrees, and all these lines here should be diverging equally. We can see that C3, C4, C6, and C7 are restricted in flexion. When you look at the occiput in the atlas, this should actually be opening up to 3 degrees, and it's at 11. This should be at 10.5 degrees, and it's 8 degrees. So we come here with the adjustments. What we need to do is go inferior to superior on the occiput. The atlas should compensate, and then also we have to go posterior to anterior on C3, C4, C6, and C7. This is the cervical extension x-ray. Normal motion and extension would be 70 degrees. She's at 75 degrees, so there's hypermobility in the entire cervical spine. We do kind of look for the loss of motion, segment integrity, and interruption in George's line in both flexion and extension. Now here, the occiput in relationship to C2 has gone 55 degrees. Atlas has gone 26 degrees, and it should be 33 degrees and 25.5 degrees. So we've got hypermobility there. Now all the lines with C2, 3, 4, 5, and 6 are converging together, but C7 isn't. So the hypermobility here is compensated by hypomobility down below at C7. In other words, when we adjust this area here, we're going to focus primarily on adjusting the C7 vertebra, and by doing that, creating more hypermobility here, it's going to decrease the hypermobility up on top. We're going to go ahead then with the arthrostim adjustment. I'm going to use the large double prong at 6 times per second. We're going to bring it slightly into flexion. I'm going to come suboccipital 6 times per second, right on the inferior aspect of the occiput, and I'm going to slide down to the inferior aspect of the atlas, posterior arch, bring it into extension slightly. Then we're going to switch to a smaller stylus. We're going to go superior to inferior on C5, 6, 7, as we discussed on the x-rays. That's 7. And then we're going to switch to the single prong. And we're going to do C2, superior to inferior, and posterior to anterior. Just like that. Coming back and double checking. The only thing I want to do is come back here. We're in the flexion. We already got C3, 4, 6, and 7. So I just want to come in C7 in extension and adjust her here. Okay. And then the atlas. And then we're going to come down. C5, C6, C7. Then we're going to switch to the single prong and come directly on C2. Bring it down just a little bit more. And there. Nice. Good. Okay. We're going to look at the cervical dorsal nasium x-ray. We've got a right upper angle of 7 degrees, a left lower angle of 6 degrees. Now we go ahead and look at this with relative to the atlas. We can bring this one side, the right side, down, or we can bring the left side up to accomplish the same thing. We're going to take a look at both adjustments. The next thing that we're looking at here is that the C2 spinous is rotated off to the right side 3 millimeters. So we're going to come in with a posterior 30-degree line to drive from a posterior vertical. We're going to make a lamina-spinous contact and adjust in this area to bring the spinous itself from the right back to the midline. Below this, we've got a right cervical dorsal angle and then a left dorsal upper dorsal lower angle. Now this is compensated, so as we take 6 out of here, all this should decrease accordingly. But in this situation, because we've got a right CD, we're going to go ahead and adjust that right CD angle. We're going to come in on the lamina-spinous junction of C6, 7, T1, T2, and then a P to A on the high transverse side of T2, T1, C7, and C6. Now, we can't do this, the nasium, cervical dorsal nasium adjustment without taking into consideration with the rotation of the atlas. And on here we can see the atlas is rotated left anterior 2 degrees. So as we come in and adjust the left lower angle, we're going to have to come from an anterior line of drive. If we come in and adjust the right upper angle, we have to come in with a posterior line of drive. This is extremely important to be able to get the correct line of drive into the patient. We're going to go ahead and look at that cervical dorsal angle. We've got a right CD angle. When we rotate the head to the left side, that'll decrease it. I'm going to come on the high transverse at 6 times per second. T2, T1, C7, C6, and then I'm going to come on the right lamina-pedicle junction. Let's go C6, C7, T1, T2. Now as I'm doing this, I'm keeping the head rotated and I'm lifting up in traction at the same time. Next area we'll come to is the C2 spinous. So we're going to come on the lamina-spinous junction of C2. I'm going to keep the head neutral, but I'm again lifting traction at the same time. Again at 6 times per second. You can just kind of feel it start to move. Then we're going to switch to the right lower angle. Now we're going to laterally flex the head away from the lower angle to decrease that. We're going to turn the head to the left side to decrease the CD angle. As we said in the x-ray, she has anterior rotation on the left side. So we're going to come on the inferior anterior aspect of the atlas here. I'm going to get right in here. I'm going to come traction again. I've got the rotation. Okay. And then we're going to go to the opposite side. We've got right upper angle of 7 degrees, posterior 2 degrees of the atlas rotation. Again, I'm going to do a little bit of right lateral flexion to get away from the left lower angle, a little bit of right rotation. This is a superior to inferior line of drive. Both of them are about at a 30-degree line of drive, anterior, posterior. This one is superior to inferior. The other one was superior to inferior. There. This is going to be correlated with the neurological leg check. After adjusting that lower angle, the leg should balance out. We're going to go ahead and adjust the cervical dorsal angle. This is kind of hard. So now we're coming on the high transverse side. And then we're going to come in on the lamina-spinous side on the opposite side. Okay.
That's her right, yeah.
C2 spinous adjustment. Okay. Open your mouth wide. Good. Stop. Oh, good. Now we're going to go ahead and adjust the left lower angle with anti-rotation. Laterally flex away from the lower angle, rotate away from the CD. There. Okay, so just a little bit now. Good. Okay. Go ahead. We're going to adjust now for upper angle with posterior rotation. So I'm in the back of the posterior aspect of C1. There. Okay. All right.